That day we were seeing about the posture correction, the reason for the postural change, and what are the postural correction techniques we use, and how do we change their correct their posture. Okay, so it is just a continuation of the class. So this will be our PT management after our assessment. I think last class we completed all the assessment, right? Anyone? Did we complete all the assessment last class? Okay, so I remember completing everything and starting with the PT management. So I'll just continue with that. If you remember that we did not complete any portion, you just let me know, then we will go back. So first is posture correction. So posture correction, I have shown you a lot of videos, and I have explained how to correct their posture. Okay, so explain them clearly how to correct their posture in sitting, standing. Okay, so make them to stand in front of the mirror. Then you have to teach them properly. Is that clear? So I remember doing till the posture correction. So we will go to the next. So next will be the exercises. So like lying down, you can make them to lie down in side lying, like how you will be making them to give a pillow in between the knee, in between the legs, and make them to lie down in side lying. So nowadays, like we have something called pregnancy pillows. So you can also make use of those pregnancy pillows. Is that clear? So if you want, I'll send other videos related to this lying and kneeling, all those things. Okay, so next will be the exercises. So we need to strengthen the weakened exercises. So last class itself, we saw some of the common weak muscles, and we need to strengthen those weak muscles. So the first thing, if you see, it is isometric exercises to neck flexors. So when you see like isometric exercises for neck, so first thing you can see the isometric neck exercises. You need to make the person to be sitting comfortably, maybe in front of the mirror, or like you can also make them to sit sit on a Swiss ball if they are very comfortable on it. So make them to sit on that, and make sure the shoulder is straight. So normally the pregnant women's shoulder will be rounded, forward stoop, and the hands will be internally rotated. So you have to make them to sit straight with the shoulders broadened and hands externally rotated or hands in neutral position. Okay, so in that, you can ask them to hold the head on all four directions. So make them to hold the head like this. Then ask them to push behind, hold for 10 seconds and relax. So normally isometric exercises have to be done for 10 counts or 7 seconds. So that is a basic rule as per the research. So you need to ask them to hold it behind. Make sure the neck is straight. So the neck should not be stooped forward or it should not be extended. The neck has to be neutral. Then push the neck behind. Don't hold the hand up and push like this. They have to hold the hand at the lower neck. Then they have to push the whole head behind. Okay, so push, hold for 10 seconds, then relax. Then same wise, they have to hold at the side, on each side. Then they have to push their neck. So when they are pushing the neck, so I'm just telling you the common mistakes normally a person will be doing. So you need to avoid all those mistakes. So when they are pushing on the side, what they will do is they will be pushing like this. Okay, like this, like this. So you have to tell them that they have to keep the neck straight and push on the side. So they can also hold it at the ears so that they don't flex or they don't extend, or they don't side bend, all those things. So avoid all those things. May keep the head straight and ask them to do isometric neck exercise. Okay, so all these are normal exercise which we already know it. So that's why I'm just doing myself, and I'm going with it. So if you have any doubts, then you just tell me. So I hope all these exercises you would have learned in exercise therapy. Okay, is that clear? So that's why I'm just explaining in video, and I'm just going. Is that clear? So do you want any videos for that? YouTube videos for all these things? Somebody can talk. Okay, so you message me if you want real YouTube videos. Okay. So keeping that, like you are in the final final year, like pre-final year, I'm just thinking that you know all about all these exercises, whichever you have learned in your diploma and your previous classes. So I'm just explaining the exercise through video, and I'm also explaining what are the common mistakes you will be doing in this exercise. Exactly. Yeah. So hold it. So this exercise they have to do on all four directions. So this is to strengthen the neck muscles. And so especially if you see, you need to strengthen the neck flexors. So flexors, all these three. Okay, plus the extensors. So this is your isometric neck exercise. Next is using the TheraBand, you have to strengthen the scapular retractors. So retractors are your rhomboids muscle. So normally because of the enlarged chest, the shoulder will go for rounded posture. Because of the weight of the breast, the shoulder will go for rounded posture. So you need to teach them the shoulder extension. So for that, first is you need to teach them the shoulder shrugging exercise. So make them sit in the front of a mirror, then ask them to do the shoulder shrugging. So ask them to lift up, hold for 10 seconds and relax. You can also give resistance when they are doing shoulder shrugging. So this one you can do. Then you can make them to do the shoulder circumduction exercise. So ask them to keep the hands on the shoulder, bring the hands forward, then go back. So this can be done clockwise and anti-clockwise. And the third exercise is this one. So this three exercises is to make the shoulder broader. So to reduce the shoulder protracted position. So along with this three, then you have to go for the shoulder rhomboids exercise. So for that you can use a TheraBand. One minute. So So you can ask them to buy a TheraBand of a normal resistance. In TheraBand, we have many resistance. So here we will be having four resistance. That is minimal, then heavy, more heavy like that. Like you will be having four colors. So this is a normal resistance. So you can ask them to buy a normal resistance. Then they have to sit or they have to stand. Then let them hold the TheraBand in the hand. Okay, so like this. Then ask them to extend. Okay, so this will help them to strengthen their shoulder retractors. So especially the rhomboid muscle. So this is the next exercise. So we have seen isometric neck exercise. Then next come for the scapula. So first you have to do shoulder shrugging exercise. So shoulder shrugging. So with resistance and without resistance, then after that, to relax the shoulder, you have to go for the arm circumduction exercises. So that is clockwise, anti-clockwise, then forward and backward. Then next is this, using the TheraBand, you can strengthen the scapular retractors. Then using the same TheraBand, you can also strengthen the shoulder external rotators. So normally shoulder external rotation is, it is done like this. So with the arm in neutral, they can do the shoulder external rotation exercise. So this is internal rotation and this is external rotation. So what you can do is you can ask them to you can make them to hold the TheraBand in one hand, or they can also tie the TheraBand over a table or a window like that. Then ask them to hold this, then do external rotation. Without shoulder, the shoulder should not come like this. Is that clear? The shoulder should be neutral and they are supposed to do only rotation. So this is for strengthening the shoulder external rotators. Next is abdominal exercise. So in abdominal exercise, normally we don't go with very heavy abdominal exercises, because definitely the person will be, definitely the abdominal muscle will be going for weakness as the pregnancy progress. So we don't give very, we don't ask them to do a very, we don't ask them to do a lot of abdominal exercise. Instead, we can ask them to do isometric abdominal exercise at the initial stage. Then along with the, whenever they are sitting over a Swiss ball or whenever sitting over a chair, they can just contract the abdomen and relax. So this is just to maintain, but even though if they do the exercise also, it is going to become little weaker because of the distension. So after the delivery, they can go for the complete graded abdominal exercises. So till that, you can teach them isometric exercise. Then just like abdominal retraction exercise. So sitting on a chair or sitting on a Swiss ball, you can ask them a person to just retract the abdomen. It is like pull the abdomen inside without breath holding. So without breath holding, they have to pull the abdomen. Then they have to hold for a few seconds, then relax. So this is your abdominal retraction exercise. So this one you can teach them. Then you can teach the pelvic floor muscle exercise. So pelvic floor muscle exercise, in again same like abdominal exercise, pelvic floor muscle exercise, muscle also will be undergoing weakness throughout the pregnancy and after delivery also, because of the, if they undergo a normal delivery, definitely it is going to become weaker. But still you can ask them to do this exercise. So for pelvic floor exercise, first you need to make them to understand where is the pelvic floor muscle. So for that, make them to sit on the edge of the chair. So let them sit on the edge of the chair with legs apart. Okay, so with legs apart, let them sit on the edge of the chair. So at the, when they are sitting like this, the in between the thighs, one particular muscle will be touching the chair. So ask them to contract that particular muscle. So when they contract the particular muscle, they can feel the muscle is getting shrink and pulled upwards. Is that clear? They can feel as if the muscle is getting shrink and pulled upwards. So you can try now, like wherever you're sitting, you can just try that. So sit on the edge of the chair, keep the legs little apart, and you just see a particular muscle will be touching your chair. So that muscle is your pelvic floor muscle. Now try to contract or squeeze as if you are stopping the urine and feces. So then you can just see the muscle will just contract and pull upwards. So that is your pelvic floor muscle exercise. So you can either, if the muscle is very weak, they may not be able to squeeze all three openings together. So all three openings means urethra, vagina and the anus. So they may not be able to close all three, but let them try to close one by one. Okay, so let them just try to close one by one. So let them try to squeeze as much as possible and hold for 10 seconds, then relax. Is that clear? So this pelvic floor muscle exercise, we will try to try to redo when we are doing the other like Euro pelvic dysfunction. Again, I will be teaching the pelvic floor muscle exercise. Okay. So this is one type of exercise. So in this we have slow phase, fast, and mixed. So slow means you contract, hold for 10 seconds, then relax. That is your slow exercise. Fast is you contract, then relax. That is fast exercise. Mixed means you contract, mixed means you make them to do few of slow, few of fast in between, like a alternative, like a mix and match, something like that. Okay, so that is your pelvic floor muscle exercise. Then you can teach them strengthening hip extensors and abductors. So especially the muscle will be tight. They might have tight adductors. So the abductors will be weakened. So you teach them good hip extensors and abductors. So you can use same TheraBand. You can use weight cuff. You can make the person to stand, and you can make them to do hip extension exercise. I hope you know how to do hip extension exercise. So either you can just tie the TheraBand at the lower leg and tie the TheraBand over a chair and may like stand in front of the chair and do the extension. So stand in front of the chair and do the extension. It's not possible to show. Okay. So you make them to stand in front of the chair and tie the TheraBand over the lower leg or a weight cuff, tie the weight cuff on the lower leg, then ask them to do shoulder extension, hip extension exercise. Same like that, you can also make them to do hip abductor exercise. So you can also make them to be in side lying and do this hip adductor exercise. Okay. So these two you can strengthen, then strengthen ankle plantar flexion. So ankle plantar flexion, you can make them to sit or make them to lie and make them to do this ankle plantar flexion exercise. So these are the exercises for strengthening. Same wise, you have to teach them for stretching. See, I'm not going in depth because all these exercises you have already learned in your exercise therapy. So if you don't know anything, text me, then later we will discuss further. Is that clear? So first thing is you need to stretch the common muscles whichever undergo tightness. The first is upper neck extensor. So most of the time the neck will be in extension because of their posture. So because of their changes in the posture, the neck will be in extension. So you need to stretch the upper neck extensor. So you can stretch um, so you can make them to sit and you can stretch. You can stretch upper trapezium, you can stretch SEM. So that will indirectly stretch your extensors also. Okay. So then you can also stretching upper extensors will be like sitting or make them to sit, then make them to do as much as of neck flexion. So that will give you upper neck extensors. So here when you think about neck muscles, you will not have a single muscle, you will have many muscles together. Okay, so that's why you need to stretch almost all the neck muscles to maintain their to normalize their neck extensors. Then shoulder protractors. So whenever you are doing shoulder retractor exercise, automatically you will be able to stretch the shoulder protractors. Then you can also stretch your pectoralis major and minor. So pectoralis, for stretching pectoralis major and minor, you will be keeping the hands over a corner of the room. So that is nothing but your wall stretches. So you just imagine I'm standing in the corner of a room. Keep the hands on both the both the walls. Then stretch your upper back. So this will help you to stretch. So you need to first see how is your shoulder. So you need to keep the shoulder at 90°. Then keep both the hands on the walls on both sides. Then do bring forward. Okay, so this will give you stretch for your shoulder protractors. Then stretch your internal rotators. So when you do external rotation, automatically the internal rotators will be getting stretched. Then you can stretch your lower back extensors, but you may not be able to stretch like our normal person. So you can make them to do pelvic tilting exercise. So when you do pelvic tilting exercise, automatically you will be able to stretch the lower back extensors. Then stretching the perineal muscle, I will teach you the stretching the perineal muscle later. So when I am teaching the palpation, another thing. The next is stretching your hip flexors and adductors. So stretching your adductors is nothing but positioning the person in supine lying, and you will be stretching. But since they will not be able to lie down in supine lying for a long time, you may not be able to stretch as normal. But still you can also stretch when you are in side lying with single leg. Okay, so make the person to be in side lying, then you can do the adductor stretching by doing a hip abduction. So single leg also you can do. But if the person is in the initial trimester, you can position them in supine lying and you will be able to stretch their adductors. Exactly. So these are the stretching. So if you want to have the videos of all these things, I still have. I will upload in the LMS. But since like all these exercises we already know, I'm not going showing you in the class because it will be taking a lot of time, and like we will be wasting a lot of time. So that's why I'm not showing this. But I will upload all these videos in the LMS. You can just have a look. Okay. So the next, so these are the commonly whenever a person is coming to you for 1 day or 2 day with any problem, then you can assess them and you can teach. You can do all these exercise according to their need. So not all the muscles you need to stretch because the person may not have all the muscle tightness. So some people will have scapular protractors tightness. Some people will have low back tightness, like that. So according to the need, you can do the exercise. It's not that you have to do all the exercise. Is that clear? That is one point. Then definitely you need to modify the exercise and do it. So you cannot just do like a normal person. So you have to modify the exercises and do it. Especially when you're doing stretching, you need to be very careful because the already the muscles will be loose because of the hormonal changes and other thing. So when you further stretch, it may lead to subluxation or some other problem. So you need to be very careful whenever you are doing stretching and whenever you are doing strengthening. Don't give them more weight. So go through the guidelines. According to the guidelines, you have to do the exercises. Okay, so this is so when we are talking about antenatal, you can see either the patient may come to you with a problem. So problem like I have a low back pain, or I have SI joint pain, or I have shoulder pain, I have thoracic pain, like that. So either the patient will come to you with a problem, or the patient may come to you for the antenatal classes. So when you see antenatal classes, you have a set of exercises to do during the antenatal classes. So still in the antenatal classes also, when they come in, you need to perform certain assessment. You need to get reference from the doctor concerned. Then only you have to start the exercises. Do not start the exercises directly. You have to do a assessment. Then only you can make them as a group, put all the similar problem persons in a group, and you can start the classes. Okay, so I hope like Dr. Deepthi would have run through all the antenatal classes in her theory. Okay, so we'll just see the practical aspects alone. So first, uh, if you see here, like antenatal group should be formed after doctor's consent, and the group should be very 6 to 8% or 6 to 8%, because they will be attending along with their partners. So the group will become bigger when you are making them making a bigger group. So for example, if you are taking up 6 ladies, then definitely 12 people will be in the room along with the partner. So you make sure that you have a very very small group, not a bigger group. So maximum you can have up to 16%. So 16% means 8 couples. Is that clear? So before starting the classes, you make sure go through all the medical records, go through for the contraindications, check. Then if they are free of contraindication, then start with the exercise. And always do remember, you cannot just practice all the things for all the patient. The exercises has to be tailor made according to the particular person. Okay, some person may not be able to do certain exercise, so you have to check that and modify according to the individual. Exactly. So that is another one. Then most of the time they will be coming to this antenatal classes in the second trimester, because almost it will take 2 months for them to confirm the pregnancy, whether the pregnancy is normal, all those things. Then, as I said early, it will take at least 12 to 20 weeks for the placenta to get attached properly. So 20 weeks means almost it is 4 months. So after 4 months only, they will be little confident about their pregnancy, and they will be coming for the antenatal classes. So most of the time, the antenatal classes will be done at 32 weeks to 36 weeks. Okay, so most at the late 36 weeks, but mostly it will be done by 30 to 32 weeks. So you keep in mind they will be coming to you at the second trimester. So you have to avoid all the supine lying positions. So you have to go with sitting, standing, or side lying positions. So don't do any exercise with supine lying. Exactly. So keeping all these things in mind, we will just go. So this antenatal class is a 6 weeks class, but normally it doesn't go with a very planned schedule. It will be little bit lesser or little bit extended. But for a theoretical purpose, we see like it was done by 6 weeks class. So in the week one, in the first week, when they come, you will be scrutinizing them, you will be doing the assessment, then you will be grouping them according to their common problems. So once you group them, then you make them to have a ice breaking. So like how we do for our senior juniors. So same like that, we will be having a ice breaking session. So this ice breaking session will help them to mingle with each other. So that is main thing. And they will talk about their problems. Then they will, most of the time, women's will have more anxiety. So they may see, okay, like last pregnancy, I did not have this problem. This pregnancy, I have this problem. Only like in the world, only I'm having this much problem. Others are very normal, like that. So when they talk to each other, they will come to know that everybody has some of the other problems. So they will understand, okay, this is common in pregnancy and this is normal in pregnancy. That's why you need to have a good ice breaking session. So let them talk among each other, let them uh, introduce themselves, let them talk, they let them understand the problems and other things. So this is the first thing you have to do in the week one. Then after that, slowly you start with the exercises. So you start with ankle toe exercises, then pelvic tilting exercises, pelvic floor exercises, then wall press, then squatting, then see according to their muscle weakness and according to their muscle tightness, you have to go with that, with all those exercises. So ankle toe exercises, I hope you know what is ankle toe movement. So you need to teach them good ankle toe movement. So that is for circulation, and that will help them to reduce the edema in the foot. So that is first. Then next is pelvic tilting. So pelvic tilting, you will be able to do. So pelvic tilting, you have to teach them to be in sitting, standing, and in kneeling, in quadruped position. So you make them sit at the edge of in the chair and like this. So let them bring the pelvis forward, and this is forward, and let them bring the pelvis backward. So you can also make them to do in ball, so that they will be able to do it in a very good, like they will be able to do in a along with the proprioception, they will be able to improve their lower back. So this is in standing and this is in quadruped. I'll show you the videos. Okay, then next is like you need to teach them for posture. So posture, So in case if they have back pain, you can give them a good posture correction. You can give them a belt and other things. Okay, so along with that, you have to teach them the ergonomics. So ergonomics means how to sit, how to stand, and how to avoid the stoop sitting. So they are supposed to have a pillow and they are supposed to sit erect. With pillow or without pillow, they are supposed to sit erect. They should not go for this slanting or they should not go for this stooping. So this is very, very important. So this is how they need to stand. So this will be along with the posture correction. So along with the posture correction, you will be able to make them to have a good ergonomics. So this is another one. So how to lift things from the floor, how to drive a car, how to do activities. So not only baby, other activities. So this is how you need to give them a good ergonomic advice so that they avoid all the wrong positions. So this is wrong. So whenever they do all these wrong position, they might end up in back pain. So that's why you have to teach this in the first week and create awareness so that they don't get back pain. Is that clear? So this is very, very important. Then some of the other things you have to teach is they might have symphysis pubis dysfunction. So this is because of the hormonal changes, the joints will become loose and they might end up in symphysis pubis dysfunction. So for these people, you need to teach good abductor strengthening. So you can position them, you can make them to wear this around the thigh and ask them to do the exercise. So this is very, very important exercise. Then you can teach them good hip abductors exercise. Then you advise them to keep the leg in adduction. So that is more important. Okay. Then pelvic floor exercise as usual. Then pelvic tilting exercise and ankle toe movement exercise for to avoid to increase the circulation to avoid cramps. So when you are teaching the stretching, you can teach them the calf stretching also, because most of the time the women will have dehydration and they will have lesser calcium and they may end up in cramps during night. So you have to teach them good calf stretching. Okay, so you can add that in the slides. Then next is you teach them good coping up strategy and relaxation technique. So coping up strategy is like deviating the concentration on other things. So that is called coping up strategy. Then such as like hearing music, warm bath, shower, go for a walk, go for dancing, but not a Zumba or a fast ballistic dancing. Go for a small slow dancing. You can also give them teach them massage and ask them to do massage. So how to teach, we are going to see now. Okay. Then relaxation maximum you can see. Visual relaxation technique is a very, very effective technique. So how to do visual imaginary technique is when you are talking to them itself, you just get to know what are the happy moments in their life. According to their happy moments, you can make them to sit in a room, ask them to close their eyes and slowly start to talk to them. So in such a way that, okay, now you close your eyes. In case if the women likes breezy, likes to do gardening, then you can say, okay ma'am, you just close your eyes. Now you just imagine you are in the garden. Okay, so now can you just feel the cool breeze. So okay, you take in the cool breeze, you breathe in the cool breeze, like that you just keep on talking about their happy moments and make them to bring back their happy moments. So that will help them good relaxation mentally, which will be reflecting on their body. Okay, so that is the visualization and imaginary technique. So you have to know what is their happy moment. So people who don't like beaches, don't talk them about the beach. So then instead of giving them relaxation, they might have tension. So they maybe have a fear of water. And if you just see, now you are sitting in a beach, now the water is like touching your feet like that. If you talk to them, then instead of relaxing, they will get more tensed. So you get to know what is their happy moments. According to that, you make them, you talk to them and make them to bring back the happy moments in their life. Okay, so this is your visualization and imaginary technique. So you can also teach them contrast method. So contrast method is if a particular muscle is tight. So for example, most of them, they will be having a rounded shoulder like that. So when they have rounded shoulder, the anterior part is tight and the posterior part is weak. So here, when you are teaching them the contrast method, what you have to do is, if the anterior part is tight, then you have to contract the posterior. So make them to do the retraction, then protraction. So retraction first, when they are doing retraction, automatically because of the reciprocal inhibition, the tight muscle will become loose. So that is your PNF stretching. So this is the contrast method. So do opposite to the affected muscle. You can also do the Jacobson's. That means further contract the affected muscle. So if they have a stoop posture, further make them to do stoop. So this also will help them to relax the muscle. So this is your Michelin's Jacobson's technique. So you can teach any relaxation technique according to the need. So if they don't have any particular muscle tightness, then you can go for visualization and imaginary technique. That is very, very effective. Then if they have any particular muscle tightness, then you can go for contrast method or Jacobson's method. Then you can also do touch and massage. So mainly touch and massage will be your stroking and kneading. So you can do stroking and kneading over the lower back, over the whole back, and especially over the lower abdomen. So this will help them to relax the muscles. Okay, so then you can also teach them breathing exercise, especially deep breathing exercise. Okay. So then some of the relaxation positions. So these are the relaxation positions. So this position you have to avoid after second trimester. So only in the first trimester they can go for the supine lying position. After that you should not tell them to go for the supine lying position. So these are some of the relaxation positions which will help them to relax themselves. So all these will be in the week 1 classes. So week 1 classes means it is not a 1 day class, it is a week class. So maybe they will come to the class for 3 or 4 times or alternative days in a week. So minimum they will come twice or thrice in a week. So you should not teach all the exercises in 1 day. So you can divide and teach them accordingly. Okay, so this is week 1 class. So now in the week 2, mainly we have to teach them about the labor. Especially you need to teach them about the first phase of labor. So first phase of labor, how to deviate themselves from the labor pain. So slowly the contraction will start and slowly they will be feeling the pain, but the pain will not be so much. So according to the pain, what are the things we can do? So first is we can do a relaxation technique. So for that, coping up strategies. So deviate them from the pain. So that is the coping up strategy. So ask the couple to be along with them and help them in all the ways. Then next is breathing exercise. So the breathing exercise which you have to do in this particular time is called focused breathing. So focused breathing is, so you focus on a different object so that you don't concentrate in the contraction and you don't panic and you don't increase the stress. So that is called as focused breathing. So you can make them to see on any wall or anything, then you can ask them to focus on it and do the exercise. So here if you see, we will start with 2 cleansing breath. So initially you will do 1 cleansing breath, then at the end of the contraction you will do 1 cleansing breath. So cleansing breath is nothing but take deep breathing and blow out through the mouth. So this is called cleansing breathing. So when you breathe out, automatically the whole tension will go off. Okay. So this is in the second week. So third week will be the other starting up coping up strategies, like again breathing exercise. You can also give tense. You can give massage. Okay. Then you can teach them different positions because they will be in the second stage of labor. So let them go for the different positions that will help them to increase the labor stages. Okay. So regarding the exercises I will teach, So here in the second phase, again, you will be doing 2 cleansing breaths at the initial of contraction and at the end of the contraction, but you have to blow out. So when you blow out, you can make them to make a vocal sound. This will help them to relax their body. So when they say like that, he or ha, like that, so they will try to blow out faster. So when they blow out for a longer time, automatically they will be blowing out their stress, and they will be trying to avoid to concentrate on the pain. So this will help you to make you avoid hyperventilation and avoid Valsova maneuver. Okay, so in the second phase, you need to do, along with the 2 cleansing breathing exercise, you need to increase the vocal sound. In the third, also same thing, you will be adding furthermore vocal sound. Okay, so massage, you can do it over the lower back. You can start doing kneading, stroking using a tennis ball and other thing. I'll show you the video. Okay, so all these, like Dr. Deepthi might have told you in the theory classes I saw in the slide. So she would have she would have taught all these things theoretically. I'll show you the video so that you understand more. Okay, so we'll go into the first video. Actually, like all these videos are for very long duration, but I will just cut the video and show you little by little whichever is needed. Is that clear? But later on, you sit and watch the whole video so that you get a complete idea about how the antenatal classes are done. Okay. Welcome to our antenatal education class. Okay, so what is the next class? Hello. What is the next class?
Research class.
Oh, okay. Okay, so I think the video will go a little longer. So what I will do is I will upload the video in LMS. You can go through, then we can have a discussion. Is that clear? Okay, only I will just show you the breathing exercise alone. Yeah, this is a real-time antenatal class. So it will be like, it will give you a good idea how the classes will be. Okay, so you just watch this breathing exercise alone.
Miss, the video sound is not clear.
Oh,
Maybe we
one
can
minute.
watch ourselves.
But also be happy to get the show on the
Okay.
road, right?
But
You're having a baby,
can you hear it now?
very social. You're like, she's smiling about so she's talking
Now can hear,
a lot of attention.
Not clear.
Want you
but the video now can hear a bit.
Is it okay now?
Lagi, Miss.
Okay, so you want me to send the video so that you will watch it later?
Okay, Miss.
Yes, can, Miss.
Because I think this is the maximum volume of the video. I don't know whether it is the problem with my laptop or are you able to hear when you watch separately?
Miss.
Okay, so I'll just briefly explain the six classes so that then you can watch. So our part will be like how our part will be how to deal with the labor mainly. So that's what you're going to teach them in the first 4 weeks of classes. So the first week class will be mainly to make them to 1 minute. Hello. Oh, yes, ma'am. Sorry. So our idea is to have in the first week our idea is to make them stronger, that is by doing strengthening, stretching, and by making them to have a good posture. So that is the first week program. So from second week to fourth week we will be teaching them the stages of labor. So what are the things that will happen in each stage, then during each stage how as a PT we will be able to help them. So we will be able to help them by teaching them good breathing technique. So each stage have a different breathing technique that you have to teach them. Then you can teach them massage, relaxation technique, and lastly the relaxation positions. So breathing technique and relaxation positions will be changing from stages to stages. So stage 1 will be having different, stage 2 will be different, like that. Okay, massage and relaxation technique will be same throughout. Okay, so apart from this four things, our other role is using the tens. So the tens can be we can use the pocket tens so that we will be able to. Okay, we can use the pocket tens so that we can teach them and they can use whenever they get the pain, because this labor might take 2 days also and we don't know when they get pain. So we cannot just rush to them whenever they get pain. So usually we ask them to get a pocket tens or we give them the pocket tens during the labor. But in the class we teach them how to do. So in the first stage, the pain will be more in the in from T12 T11 to T12 area. So we will be placing the tents in that area in the first stage of labor. In the second stage of labor we will be placing mainly 4 leads, that is T10 to L1 and S2 to S4. So 4 leads we will be keeping. In the first stage we can keep 2. So we can use any mode, then we can teach them how to increase and decrease the tens. So we can teach them how to increase the knob and decrease the knob so that they can increase and decrease whenever they need it. So this is the fifth strategy they have to do during the labor. Okay, then in the so all these things we will be teaching in the first 4 weeks. Then in the fifth week we can teach about the different types of delivery we have, that is we have normal delivery, cesarean delivery, assisted delivery. Then what are the pain relieving methods they can use? They can go for epidural injections and other thing. their medicines they can use during to reduce pain. Although regarding we are just giving awareness regarding the different methods they can use if they want it. Then we can also give them the brief outline about the postnatal period, about the postnatal exercises and breastfeeding. Okay, so in the sixth week, totally towards we need to teach them about the postnatal time. Especially this antenatal class will be very useful for for couples who have their first baby, because they will not be aware of anything. So they may be very much panicking, and they may be very much anxiety about all those things. They may not be able to know how to hold the baby itself. So in the sixth week, you will be mainly teaching about the postnatal time. So during the postnatal time, how to hold the baby, how to feed the baby, how to soothe the baby if the baby is crying, how to adjust to the postnatal time. So mainly the women will be too much stressed, and she may end up in a lot of depression and other postnatal problems. So you give a good idea about that in the antenatal class, so the partner will understand her more during the postnatal time. So mainly you have to make the partner to understand the problems and the pain and the other things the women will going through, and how they will be able to reduce their problem. So that only you are going to teach in the sixth week. Okay, so these are the brief introduction about the week. So you watch the videos, then we can discuss if you have any doubts. Is that clear?
Yes, Miss.
Okay. So I will send you some 6 videos. You take time. All the videos are a little longer. It will take time. You just watch it, and then we will meet in the second class. So next class we will see about the relieving discomforts. So during pregnancy, the mother will be having certain discomforts. As a PT, how we can relieve those discomforts. So that one we will see. So mainly on Friday, I think you have your exam, right? 12 to 1, you have your exam on Friday.
11 to 1 minute.
So you tell me when you want to have your next class. So that I think before your break, let me complete your pregnancy relieving discomfort. Because till that only Dr. Deepti has taken the theory. So I will also complete that. So you give me 1 hour so that I'll complete the other things. Is that clear? Okay,
Okay.
so discuss among yourself, and you just tell me when to have class. But before the class, you try to watch these videos, and we'll have a discussion. Okay. So most probably from January, you may come back to campus. So when you come back to campus, it will like we will interact more regarding the practical session. Is that clear?
Okay.
So okay, thank you. We will see in the next class. See you in the next class.
Thank you, Miss.